Good evening, everyone. I'm Dr. Shanmugraj. I'm a nephrologist who is practicing in Palakkad. In today's session, we will discuss about pidal edema, its causes, symptoms, and treatment. Before understanding pidal edema, let's first see what is edema. Edema is simply swelling of a body part because of presence of too much of fluid within it. It can affect a small area or the whole body when it is called as anasarca. It can be caused by drugs, pregnancy, infections, and a whole lot of medical conditions. Edema occurs when the tissue swells up due to leakage of fluid from small blood vessels into the nearby tissues. Now let's discuss in detail what pedal edema is. Pedal edema is swelling of the feet and ankles caused by an abnormal buildup of fluid in the ankles, feet, and lower legs. Majority of the time, minor occurrences of pedal edema are caused by physiological causes. That is, there is no disease within the person. Edema of the foot can be caused by two different mechanisms. One is physiological, which reverses by itself, or it can be because of lot of diseases, lot of which can be very dangerous also. Pedal edema is a condition where the feet and legs expand due to standing or sitting in the same posture for an extended period of time. The muscles in the foot, they act like a pump, which pump the blood from the feet back into the heart. If the feet and the legs are kept stationary for a very long period of time, the edema can accumulate in the foot. This typically occurs when a person is sitting for a long period of time, for example, in a long flight or sitting in a movie theater. At the end of it, the person normally notices that the foot is swollen up. This usually goes off within a few hours. However, there are a lot of other causes which can cause a similar kind of edema, and a lot of which are very dangerous. Now, moving on to the cause of pedal edema. Just now, I mentioned standing or sitting for a long period of time. Here, the muscles are unable to pump body fluids back towards the heart while the muscles are inactive. There is buildup of water and blood in the lungs, which can induce swelling. Second, a blood clot in the leg. When the veins in the veins in the leg, they contain a clot, there is obstruction of flow from the lower limb back into the heart, because of which there can be swelling in the foot. Typically, the swelling in this case is unilateral. That is, it affects only one leg. When a blood clot like this happens, it can also be dangerous because once this clot is dislodged, it can go back into the heart or into the lungs, what we call as a pulmonary thromboembolism. Injury or infection, they can also lead to swelling of the foot. Here, it is because of the leakiness of the capillaries and the blood vessels because of the presence of inflammation, which is caused because of the injury. Venous insufficiency. The leg veins or blood vessels are weakened or damaged in chronic venous insufficiency, and they're unable to take the blood back into the heart efficiently. As a result, there is always a pooling of blood within the legs. This also leads to edema. Preeclampsia. This occurs in ladies during pregnancy. This is caused by elevated blood pressure during pregnancy. It is an abnormal condition and has to be managed very, very carefully. Cirrhosis. Cirrhosis is a disease of the liver wherein there is chronic scarring of the liver, because of which multiple factors cause swelling in the body. Predominantly occurs in the abdomen, what we call as ascites. It can later on lead to swelling in the leg. Second is congestive heart failure. One or both of the lower chambers of the heart lose the capacity to effectively pump blood in the congestive heart failure. Blood could not back up in the leg, ankles, and feet, and as a result, they cause edema. Then kidney diseases. Kidney can cause pedal edema in two different ways. When there is renal failure, the kidney is unable to excrete fluid and salt from the body. As a result, there is buildup of too much of fluid within the body. This results in edema, which can occur throughout the body. Initially, might be pronounced in the leg. Later on, it occurs in the whole body. The second renal condition is something called a nephrotic syndrome, wherein there is loss of protein through the urine because of a primary problem within the kidneys. This again leads to edema, and again These are all very serious diseases which need to be treated very aggressively. Inadequate lymphatic system. The lymphatic system of the body aids in the removal of excessive fluid from the tissues. If this system is compromised, usually by cancer, some surgery which disturbs the lymph nodes and the lymphatic system, or some infections, typically like filariasis, it can cause edema. Again, lymphatic edema might be unilateral, that is involve only one leg, or can involve both the legs. Severe and long-term protein deficiency. In a person who does not consume enough protein, or there is loss of protein from the body, it can occur through the kidneys in what I earlier mentioned, something called as nephrotic syndrome, or it can occur through the intestine, what is called as a protein losing enteropathy, because of which there can be severe protein loss in the body, and that can lead to again swelling of the limbs. Now, how do we identify piddle edema? Piddle edema is usually noticed by the patient or by the relatives or somebody close to the patient. The legs are usually swollen and they're puffy. If the leg is touched and if it is pressed, there might be a pit which is left behind, which will go off after some time. Now, coming to the treatment of piddle edema. Mild edema, which is physiological, usually goes away on its own and does not require any treatment. Like the way to accelerate the resolution of edema is to elevate the limb. You raise the leg above the level of the heart, the edema goes off very fast because it aids in the drainage of the edema. Severe edema, on the other hand, may require to be treated with medication that assist in removal of excess fluid through the urine. However, this medication has to be done under medical supervision only. And the first step is to find out the cause which has caused the edema. The treatment of the underlying cause of edema is the focus of the long-term therapy. If edema can at times occur because of a medication use, the medication might require to be changed. The common medication which causes this kind of edema is some kinds of antihypertensive drugs, especially a drug called as amlodipine, some painkillers, and of course, a whole lot of other drugs. The movement of the legs, that is moving the muscles of the edema affected area, may also help in assisting the loss of excess fluid back to from that particular part. Elevation of the limb again above the level of heart may again help in drainage of the extra fluid. Another method of removing edema is through compression, especially where there is venous insufficiency. There may be advantage in wearing something called as a compression stocking, wherein the stocking prevents the additional pooling of blood within that limb. Then other methods like reducing salt intake, reducing fluid intake, they also might help. All these mechanisms or this treatment has to be done under medical supervision only. So before we sign off, any patient who has edema should take medical consultation, and the doctor should be asked what are the possible causes of the edema, what are the treatment options which are available, and if there is a medical problem which is causing it, how to optimally manage that condition. Lastly, I would like to suggest that reducing salt consumption, doing daily activity, and leading a healthy life, they usually might help in preventing the formation of edema in the first place. However, treating edema has to be done under medical consultation. I repeat it again and again because a very dangerous disease might be lurking underneath, which is causing the edema. Thank you all for patient listening.